By way of introduction, we refer here to published work on the time course of the plasma levels of the low molecular weight heparin, enoxaparin, in human subjects. We are demonstrating today our results with a rapid point-of-care assay for low molecular weight heparin. In this case, the entity is enoxaparin. The results shown in this slide depict plasma concentration in patients who have been receiving the drug chronically once a day, 40 milligrams per day, and the time course of that last administration followed to further disappearance. You can see then that at approximately 4 hours after administration, a peak concentration of 0.4 international units per ml is achieved, and that level is within the therapeutic range of the drug. A point of particular interest also, however, is how much remains 12 hours after administration, because there is a guideline that is clinically accepted that one should wait at least 12 hours after the administration of low molecular weight heparin, in this case enoxaparin, before doing some particularly invasive procedure which might result in a risk of bleeding. It is of interest to us that there is still a clearly detectable amount present at that time, and we have focused on that in some of our studies, as we will demonstrate. Also presented in this work by Sander Inc. et al. Is the fact that individuals with renal impairment have considerably higher levels of the drug throughout the time course, and we see that the 12-hour guideline might be very inadequate in the case of a patient with renal impairment, or, as is known, in a woman who is pregnant or in patients who are obese.